Okay, hello everyone. We're going to continue with different types of insulins that are used for the management of type 1 diabetes mainly. Regarding insulin, you need to understand that before the application of them, you have to make sure that the patient is conscious and able to eat. And if for some reason the patient is unconscious, then you have to make sure that they have an IV line just in case the patient goes hypoglycemic and we need to increase glucose levels. So let me share my screen. Here we go. Okay, so we have 4 types of insulin. We have short duration, rapid acting, short duration, slower acting, intermediate duration, and long duration. So let's start with the short duration rapid acting. We have 2 of them. And let's go to the next one. We have the 2 of them here. I apologize. So we have insulin aspart and insulin lispro. You can see on the brand names, Novolog and Humalog. They have the same ending. So you know that you have a short duration, rapid acting insulin. Usually the technique is sub-Q. Once administered, it takes around 15, 30 minutes or 10 to 20 minutes, depending on the author. So don't stress on that info. Only, as an average, 10 to 20 minutes for the medication to start working. So that means that when you are teaching the administration of this type of insulin to a patient, you need to tell them, hey, this insulin has to be administered before a meal. So, based on that, patient cannot administer insulin and then go to a restaurant, start prepping the meals, because after 10 minutes, 15 minutes, glucose levels are going to start dropping. The medication, the insulin, has a duration of 3 to 6 hours. So based on this, the most common use is before meals. Every time they're going to have a meal, they can administer this type of insulin. The other one that is also short duration rapid acting is insulin glutathione. It's one of the new ones. As you can notice here, the name Apidra doesn't give you a lot of help to relate it to the other one, log ending. This one has fewer adverse effects than the other 2. The drop in glucose levels is not that drastic, so you can say that the chances of fast hypoglycemia is less likely with this one. Other than that, everything's the same. Has to be administered a few minutes before meal, and the patient has to be able to eat after that. Okay, now we're going to jump to the short duration, slow-acting insulins, or regular insulin. And as you can see here on the brand names is Humulin R, Novolin R. This one, the techniques of administration is a sub-Q injection, sub-Q infusion. That means it can be used with an insulin pump. Intramuscular, very rare, be used. And there's a presentation so far in an inhaler, which is amazing. But so far, it's not being used yet, still on trial. Hopefully in a few years we can have it, and that can prevent the constant injection of breaking of the skin for diabetic patients. Regular insulin takes around 30 minutes to 1 hour to start working, peaks between 1 and 5, and lasts 10 hours. The highlight of this type of insulin is that it's a clear solution. Okay, don't forget that one. Regular insulin is clear. Oops, went too far. Next one is an intermediate duration insulin, NPH insulin, Humulin N, Novolin M. So you can see on the brand names, they'll put an N to it. That way you know that it's NPH insulin. The highlight is that it's a cloudy suspension. The reason you need to remember this is because in a hospital setting, it's very common for doctors to tell you, hey, can you provide uh, regular insulin and NPH insulin to my patient, and they'll give you the dosage of each one. And the thing is, in order to prevent double injection, you can put them on the same syringe, but there's a specific set of steps that you need to follow where clear and cloudy be the highlight of those steps. NPH is a sub-Q technique. Then we have a long duration insulin. We have two. We have insulin glargine and insulin detamir. So this one's what they have in common is that the duration of the effect is 24 hours. These two insulins are called basal insulins, and they're only administered once daily. So those are the insulins that we have in order to treat type 1 diabetes, basically. Insulins can also be used to treat complicated type 2 diabetes patients where the oral medication that they take, they're not enough, that we need to help with insulin. Please see the video that is next to this one, because it's going to explain the technique or the steps that you need to take to mix regular insulin with NPH insulin. Okay, so I'll stop sharing slide, and I'll see you on the next video.